You're listening to the Pre-Hospital Care podcast on the Medics Academy Network.
This episode of the podcast is sponsored by the Miku M-Warmer. The M-Warmer is a portable blood and IV warming system. So Miku has developed an IV blood warmer for emergency transfusions. It's a portable fluid warmer which warms blood from cold to body temperature within seconds. The setup time is less than 30 seconds and it's a user-friendly design, ensuring that it can't be assembled incorrectly. So blood and other transfusion fluids can be heated from 5 degrees to 37 degrees as flow rates of up to 150 mils per minute. One charge battery can last up to 2 litres of cold fluids or indeed 4 litres of fluids at room temperature, so that's 21 degrees to body temperature. So the M-Warmer has a compact design and weighs only 760 grams, making it portable and ideal for pre-hospital use. The single-use warmer's small size allows it to be attached to the patient close to the infusion site and using an integrated adhesive pad. This secures the infusion site and reduces heat loss in the tubing. So the M-Warmer system is approved in all ambulances, helicopters and fixed-wing airframes. Please see the show notes for further details on this industry-leading system. Welcome back to the Pre-Hospital Care podcast with myself, Ren Walker. In this episode, I'm interviewing Vicki Brown on her trajectory and indeed career pathway through pre-hospital care. So what I wanted to do is just examine Vicki's pathway through to being an advanced practitioner in critical care, and indeed the first person in the country to get on the Faculty of Pre-Hospital Care Register of Consultant Practitioners by qualifying purely from a paramedic background. So we're going to trace her career pathway and indeed the steps she's taken to achieve such a pivotal role within pre-hospital critical care. So Vicki joined the ambulance service in 2002 and has had roles in management, learning and development and indeed on HEMS. She became the first ACP-CC for South West Ambulance Trust in 2020 and indeed the first person to register as a consultant practitioner in pre-hospital emergency medicine in 2021. Welcome to the podcast, Vicki.
Thanks, man. Thank you for inviting me.
It's great to have you with us. Vicki, I just wanted to start by unpacking your journey into pre-hospital care. Could you maybe just speak to what got you into pre-hospital care in the first instance?
So I used to work with horses, and I think one day I suddenly thought I probably should have a different career that maybe might get a little bit more money. I'd always wanted to be a vet, but I just didn't get the grades at A-levels. So a friend of mine said, well, why don't you join the ambulance service? And at the time, I literally knew nothing about it. I didn't know what a paramedic was. So I looked at my local paper. There just happened to be an advert for what was then Gloucestershire Ambulance Service. Applied and I got a job as a trainee technician. In those days, that's kind of one of the routes in. So that's how I started. So that was, over 20 years ago.
Gosh, and never look back. And I guess in that time, sort of 20 years ago, the ambulance service probably looked like a very different service, actually. But could you maybe speak to some of the salient learning points that being on that road as a paramedic has sort of reinforced for you over that 20 years?
Yeah, so like you said, it was very different. I joined as what was then called a sort of trainee technician, which went in to be a qualified technician. So I gained a lot from working with the more experienced paramedics in their roles. And you kind of, those days, you pretty much learned on the job and as you went along. But I had to kind of learn how to speak to people. And I worked in a sort of semi-rural station. So we had some pretty long journeys to go to hospital. And in that time, I mean, I was fascinating stories from people. But you kind of got to know a bit more about their illnesses and their injuries. And that kind of then, I just wanted to know more about it so that I could treat them the best I possibly could. And I think being a paramedic, I suddenly became a senior clinician on scene, and I felt myself, I didn't really know an awful lot. But you kind of get in the deep end. I felt a little bit out of my depth to start with, but I think that really good because it encourages team working, which is one of my big things. I love kind of how teams work together, not just necessarily ambulance service teams, but to be working with other teams. And I took a lot from that, just especially in the early days. I'd have another sort of technician, as they were in those days, with me, and just learn how to sort of speak to people for a long periods of time, but also how to work as a team and manage those people.
It's a really good point, actually. And I think, 20 years ago, the service hadn't evolved into higher education. So there wasn't necessarily a degree or indeed a master's prerequisite for any of the sort of band-aid roles or other roles. So it was very much in its sort of still in its formative years of education. But you kind of moved through into management, Vicki, and what did the sort of, because like you said, you were initially the senior clinician on scene, even as a paramedic, but what did sort of moving into management teach you?
I think, again, management in those days was probably slightly different. Definitely called different things. So I think, initially the sub officer and went to a station officer, but I mean, the titles were changing all the time, and I think they probably still are, to be honest. I found myself as an operational station manager. So in those days, that was kind of, you're like an area manager looking after several teams, and kind of the sort of everyday running of the ambulance service. And that was a massive steep learning curve for me. I hadn't done anything like that before. I'd managed just a team on station, but not like, sort of 100 odd people. And I think I found that you just needed to listen to people and hear what they were saying. Everybody works differently. And I think you can't have one fits everybody. So I think I had to figure out how to listen to them, how to then adapt so that I could get the best from them. So that was a pretty steep learning curve. But again, it was kind of working as a team, whilst there are obviously some things you can do on your own, but actually it seems to be, if you work together and pull together, you can get a lot more done.
Yeah, listen, that's really interesting. You said that active listening piece, and I'm trying to orchestrate that at the moment where I'm working, and but yeah, absolutely, and that's the jumping off point to that team element, I think, whereby, like I said, you can just truly get to the heart of what the issues are, but then building rapport and then building trust and then sort of working from there, really, which is key. But then you went through the managerial role, the station officer role, and then sort of progressed into education and indeed training. So could you speak to how that sort of played a seminal role within your career pathway? Because I think it sounds like the education training has been sort of maybe a foundation of where you are now still, because in high performing teams, it really is the heart of what you do, maybe at GWAC. But could you speak to that role and how it sort of informed where you are now?
Yeah, I think during sort of the management role, I got sort of really interest in supporting others, and just trying to help them really with their careers as much as, sort of working on my own. And there was an opportunity then in the education department or learning and development department in those days, to start with, just to do a sort of bit of ad hoc teaching and see if I liked it. So I did a bit of that, really enjoyed it, and went and got some qualifications in teaching. And then I started doing sort of the updates and sort of like we have now. So I think a lot of places will have their sort of essential mandatory training. So doing some CPD for all staff, and really enjoyed doing that. And I just love seeing people achieve what they didn't think they could achieve, and just getting the best out of people. So I think for me, education training is really important. And like you say, at GWAC, we do a lot of that. I'm currently the lead for GWAC for the education. And I just like to see people sort of taking opportunities if there is, if there's something there they can go and do, and encourage them to do it, because, you get some people, I can't do that, but actually they can do that, and by sort of steering them the right direction and then seeing them achieve it is just really, really rewarding. So yeah, I just love that side of it.
I think that's powerful, actually. Like I said, enabling people to step outside of what they think is possible, and then open their eyes to other things as well. So just that approach to learning. I mean, I think one of the things that struck me about your career pathway and indeed your progression to where you are now, Vicki, is that it's almost like re-signing up to learning every day. And indeed, every day is a learning day, and you can learn something different. Is that the mindset and approach you've fostered over the past 20 years?
Yes, definitely. I just think that we're all learning constantly in all aspects of life, not just, your professional life, but there's always, things you can learn. And I think with, sort of pre-hospital, there's there's new innovations coming in all the time, sort of different interventions that have, a lot of it's coming from military, a lot of it's coming from in hospital and trying to get it into the pre-hospital environment. But there's lots more research happening, especially pre-hospital, which has been pretty sparse over the years with new evidence. So I think by looking at all of this and, learning more and more, as much as I can anyway, I think is really good. And it's really good for the profession, I think, moving it forward as well. Patients are individuals. And I think even if they have a similar illness, they may sort of react differently to different treatments. And I think that's where you can also learn a lot. So we are literally learning every day. We kind of do like daily training at GWAC. So every day, a team will get together and they will do some form of sort of learning training. And that literally can be anything from a case-based discussion, go and practice a skill intervention, or actually just doing a full sim, for a patient. So every day we'll do some form of, sort of learning, teaching, training, which is really good.
I think that's really important, from not only from the, like you said, the cognitive perspective of breaking down sort of problem-based learning and then the outcomes, but also that kind of aesthetic learning of the simulation, where, like you said, you're interacting with the kit, you are reinforcing those pathways about how the kit goes together, just a simple RSI, a non-simple RSI, and then just and everything in between. But that, like you said, you just making sure that there is learning occurring every day, I think is powerful. And on that point, Vicki, just looking at some of the higher education elements that you've broached, sort of the diploma in immediate medical care, the fellowship in immediate medical care, and indeed the MSc. Yeah, there was a lot of fear. I've taken the diploma, and there was a lot of fear amongst contemporaries and indeed in myself when I took the exam, the diploma in immediate medical care. But the revelation I had was that you just got to go and do it, because actually, if you don't go and do it with some substantial studying on the front end, then it's always just going to remain sort of a fearful examination to take that you'll never grow through until you put yourself in that position. And the revelation was sometimes you've just got to step up, and even if you fail, it's okay. There's still learning that occurs from that. Could you maybe speak to your journey through the diploma, the fellowship, and indeed a master's? How has that journey looked for you?
Yeah, I definitely can feel your fear when you went to your JAWS, because I was exactly the same. But I think some of the fear is it probably was seen as kind of doctor exams. So the diploma and particularly the fellowship actually were kind of seen as, it's the doctors that go and do that. So when I did it a few years ago, and to be honest, there were very few paramedics and nurses undertaking the exam. And yes, I was pretty fearful of doing it. But like you say, you just got to go and do it. And I think these days, I'm also an examiner for both exams. And I think so a few years ago, there were very few paramedics. There were very few paramedic examiners, and particularly there were hardly any female paramedic examiners. Now we have got quite a few paramedics, doing the exams, both exams, which is really, really good. I mean, that just shows how the profession has developed, but also how the exams have developed. Both exams, they've been updated. They're now multi-professional. So, the fellowship is open to paramedics and nurses just as much as the doctors. I think they were kind of put in place a little bit as well recently for the FEM trainees that we have in the UK. So they go through a national programme. They go and sit the diploma pretty much in the sort of initial first year of training. And then their fellowship is sort of seen as the exit exam for pre-hospital. Which is great, absolutely brilliant. But I think that probably did put some of the paramedics and nurses off. And now that we've got a few sort of up there doing the exams and helping to update the exams, there's a lot more people now prepared to go and sit them, I think. I'm on the level 8 register as well for the faculty. I did it by an exemption route, which was an awful lot of portfolio work and then interviews, which was pretty daunting. But we got there. And actually now we're getting a few more paramedics on the register, which again is really good and just shows how the profession is moving forward. I did an MSc, so I didn't do a paramedic degree because it never existed in my time. It wasn't a thing. So I went straight to go and do a master's, which took probably just over 3 years actually, because I did it in a couple of different universities. And I think these days, So the academic qualifications are pretty essential to move forward in our profession. Now you have to have a paramedic, some kind of foundational, Bachelor of Science degree for a paramedic role. And I think now with, sort of the specialist practitioners, advanced practitioners, they are looking at postgraduate certificate, postgraduate diploma, and your master's. So yes, these days, definitely important to go and do that. Things have moved on, should we say, in the last 20 years.
So you work for GWAC, so Great Western Air Ambulance Charity, and you operate, I believe it's HeliMed 65, which is a helicopter by day, I believe 7 a.m. to 7 p.m. or indeed daylight hours. And then is it 1 p.m. to 1 a.m. you operate 3 cars across the region. And it's, so you see a wide case mix of both medical and trauma pathology. It's a physician and paramedic based system in the west of England, and indeed it sounds like the case mix is indeed quite varied. And indeed, the clinician base is quite varied. So you've got emergency physicians, you've got maybe anaesthetists, you're working alongside consultant anaesthetists, and indeed a whole wide variety of critical care paramedics. Could you maybe A, correct me if I'm wrong on that last statement, and B, just what you've taken from working alongside some other fantastic clinicians in the service?
Yes, no, actually, you were pretty accurate. So yes, we are HeliMed 65, and we run the helicopter on a 7 day shift. But we also put a late shift, which we've only just recently changed to a 2 till 2. So actually, you weren't far off. We have a car available for both shifts because we are based just outside of Bristol. So a lot of our work is in the city, which is often easier to get to by car. So it's exactly the same crew, exactly the same kit. It's just sometimes easier to get there. And then, so we'll have a doctor and a paramedic. The doctors are consultants, and they do vary from emergency medicine to intensive care medicine, anaesthetists, cardiologists. And we've also got some that work with the neonates. So we're a pretty broad variety of consultants. And then we've got the paramedics. So the paramedics, they start as a trainee specialist paramedic, and then they'll be qualified usually within sort of 18 months to 2 years. Then they'll work as a specialist paramedic, and we're currently just going through the process of signing off a advanced pathway within the ambulance service. So I work on the Great Western Air Ambulance Charity aircraft, but I actually come under South West Ambulance Service. And they are working towards a training pathway for the advanced practitioners. So I work with, hugely experienced consultants and paramedics, which is definitely very beneficial. I've learned absolutely loads and still learning every day. We learn something. And having those consultants from such a varied background, you can pretty much pick their brains on most things. And I've been there for over 11 years. So I think, being there for that amount of time has definitely developed me as a clinician, just gaining the knowledge and the experience that I've managed to do. And I think that's helped me with my role now, because I'm much more autonomous and feel a bit more comfortable doing that. And I think more of what I'm doing and why I'm doing it. So rather than having an illness and thinking that illness needs this medication, I'm actually thinking about why am I giving this, and all the risks and benefits involved with that. So yes, it's great working with all these people. Really, really good.
So Vicki, what does governance look like at GWAC? So for the D&D, so the Death and Disability or indeed case review and Clinical Governance Day, how do you approach governance?
So I think, as you know, governance pretty much covers everything, doesn't it? That's for some description. So yes, we do daily case reviews. So the team coming on in the morning will look at the previous team's instance from the previous day. They will go through them, discuss them between themselves, and pick up any points that might be good for the rest of the team to know about. We have a sort of fairly small governance group, which is including doctors and the paramedics, who will also look at cases, flag any cases that there may be something that everybody can learn from. And then some cases will be taken to the monthly Clinical Governance Day and presented there, so the whole team can see what went on and to see if we can take any learning from it. But we do lots of audits. So we are auditing, obviously, all our pre-hospital emergency anaesthetics. We audit all our blood administration. We audit sedation paralysis by the paramedics if there's no doctor available. And all this will link into the ambulance service, who also have monthly meetings. And the monthly meetings include all the HEMS units in SWAST, so that we know we're all kind of maintaining the standard, checking in with each other and actually sharing ideas, which is really beneficial. So yes, lots of governance happening every day of some description, which, I mean, it needs to be done. It covers everything. And yeah, I think it gets the whole team involved with it as well, which is really good.
So just looking at something you said earlier, actually, about sort of learning, the continued focus on learning, and indeed, it's wider than just being a clinician. You know, I think there's something to learn about every aspect of life in daily life. And so we you know, talking about sort of Dunning-Kruger effect, you know, when you're in your formative years, you don't necessarily know what you don't know, and then in maybe more in the summative or later years, you are acutely aware of what you don't know, and maybe a bit more judicial and maybe a bit more conservative in your approach. Would you say, as you've progressed as a clinician, has it A, changed you as a clinician, and B, have you maybe become a little bit more conservative as you've become far more senior, through sort of knowing what you don't know, and also maybe seeing how things can go wrong quite quickly with sort of high acuity, low occurrence skills? How has it changed you?
Yeah, I think you're right. You don't know what you don't know, and I'm still in that. I don't know what I don't know. But actually, the more you get to know, I think the more scared you probably get as well. Especially sort of the level of interventions that we're doing, and I think that then, well, it definitely, with me anyway, it makes you start to think, hang on a minute, this could go wrong, very wrong. So let's figure out, you know, is this beneficial for the patient to start with? And actually, what are the risks involved? And which one outweighs the other? I definitely think I think about it more. And I almost try to justify to myself why I'm doing something. So I'd kind of go in thinking, I'm not going to do anything. Okay, now I need to do whatever it might be. And that might be an anesthetic. Actually, can I justify why I'm doing this to this patient? And I think by thinking that probably makes you a little bit more cautious, probably because you know what could potentially go wrong. So yes, I think I still got a lot that I don't know. And the more I go on, the more I think, crikey, yeah, there's more to learn.
So just looking, as we're starting to come into land in the conversation, Vicki, but just looking at the pillars of advanced practice, something which I think indeed has come in sort of post that 20-year, it's come in since we both joined. But could you speak to sort of how the pillars of advanced practice are? It sounds like you're building up the advanced paramedic pathway, maybe from indeed within SWAST. Could you speak to how that you're orchestrating or building those pillars to sort of support that pathway?
Yeah, so advanced practice looks at 4 pillars, which are sort of clinical practice, education and training, leadership and management, and research. So when we started the advanced practitioner role within the ambulance service where I work, we very much looked at these 4 pillars to see where they would fit. So looking at sort of clinical practice, we looked at the scope of practice of the role. So this included sort of looking at surgical skills. So currently I can do things like a thoracotomy, a resuscitive hysterotomy, amputation, and that's without a doctor present, which is, I mean, it can be pretty scary. And I think it's actually, it's good. This is showing how the profession's moving forward, because actually that would have been, there's no way that would have even been heard of a few years ago. But also, you know, I can carry more, more drugs. We can use more drugs. So we're obviously a lot more now. Paramedics are able to do their non-medical prescribing, which is really good. So you get more of a scope of practice with that just by having your prescribing ticket. But also, I think within the clinical practice area, you've got all your decision making, and that's a pretty advanced decision making. Whereas if you've got a doctor with you, you can kind of bounce ideas off them a little bit. They are the senior clinician on scene at the end of the day. But with us now as the advanced practitioner, we're very much autonomous, and that means you're obviously making the decisions. Another pillar is the education part of it. So like we've already mentioned, I mean, I love that education teaching side of it, And that's part of it is so we're sort of teaching, we're doing mentoring and support for people that might not necessarily be a trainee, but they still want some support of, progressing their careers themselves. And also for my role, I organise the assessment days. So we have assessments for the paramedics and the doctors. So we organise that and just getting them through the next step so they can just progress with their career, whatever pathway that is. Leadership and management, that's another pillar. So I'm the clinical lead, education lead, research lead, governance lead. There's kind of a theme there at GWAC because I'm the only advanced practitioner there at the moment. But I think that's a really important part of advanced practice. It's not just about going out and being the clinician. Actually, it's leading your team as well. And then last but not least is the research side of it. And I think actually these days is becoming more pre-hospital research, which is really good. I've recently been involved with a really good study, which was to do with it's called aerator, but it was just looking at what generates aerosols, which was obviously particularly important previous pandemic. And that's been a really good study to be involved with, which hopefully should be published soon. So I shan't tell you what happened on that one yet. So the 4 pillars, we've very much gone through each one individually and put it into our advanced roles, which I think is pretty much what everybody does, both in hospital and out of hospital.
Yeah, that's powerful actually, because like you said, I think it's all encompassing and it addresses these fundamental sort of baselines really, which are needed to push the profession forward. So I completely agree actually, Vicki. As we're coming into land actually, just for listeners as we finish off, is there any sort of take-home messages that you maybe speak to sort of encourage people into that sort of lifelong learning that you've walked through, or just any take-home messages in general?
I mean, quite often I get asked with how can I do what you do? And I think the answer is probably gain as much experience as you can. I'm a strong believer that, competence with the knowledge and experience you get is very important. It's not just about your title or your role. And I think, you can't rush these things. You need time for experience. And I kind of say to people, just, enjoy being a paramedic, enjoy your paramedic journey and just gain whatever you can during that process and get the experience. So, I think it's just go and enjoy it.
I think it's fantastic advice, actually, and I would absolutely advocate the same myself. Vicki, listen, thank you for the last period of time and just for your thoughts and reflections, because they're fascinating and really insightful. So thank you.
Thank you very much for having me.
You're listening to the Pre-Hospital Care podcast on the Medics Academy Network.